had the goal in mind that, and this was booked way long before my injury, is I was going to do the Camino de Santiago in Spain. So that was coming up on October 1. My surgery was July 19th. I injured my ankle last spring playing volleyball, so I didn't go see a doctor for a few weeks, re-injured it doing yard work, and so there's something called the familiar pop that I felt in my foot, and then it was like, then I needed to seek some pretty serious help. My wife and I have actually been pretty good clients of Panorama over the last couple of years, so I was familiar with the organization and the suite of surgeons that they have. So went online, I looked at Dr. Murken's bio, it's right up, and it looked like an individual that I could work with, that would probably hopefully get me to what I needed to do. So I sought medical treatment. Well, we had our initial consultation, and of course we did this suite of x-rays, and the initial, I guess you could say, diagnosis was ruptured tendons in the foot. So, okay, what are the options? So again, in the initial consultation, we went over the options, and that was, unfortunately, not too many. The do-nothing case, which means the tendon would eventually heal, but in a weakened condition. So the other one was surgery. I said, okay, great. So as part of the conversation, I was wanting to know, well, so how many of these have you done? What's your track record? And he was pretty honest about, again, the number of times he's done this operation. So I felt comfortable that the treatment plan, which was to basically, in non-technical terms, sew the peroneal longus tendon to the brevis, which was its partner down there doing the work. We talked about you have to be your own patient advocate. And so I'm an individual that, we'll just say I ask a lot of questions, and a lot of physicians, after a certain amount of time, maybe aren't so receptive. Dr. Murken was totally receptive and gave me the time that I needed to feel comfortable with the game plan going forward. T-minus minutes after surgery, Dr. Murken communicated with my wife, who was waiting for me there at the surgical center, and advised, it all went well. Interestingly enough, he even did some extra credit work, I call, is that he did repair the ruptured tendon, but also as he was doing the surgery, found out that there were some other issues. Anything that he saw was wrong, he took care of. So the surgery was successful from an execution standpoint. Well, the rest of the story is how does that translate into everyday activities? My timeline was a little bit more aggressive as far as recovery and rehab than most folks. And the big thing about Dr. Murken, he didn't just dismiss it as not possible. He says, we can do it. I had the goal in mind that, and this was booked way long before my injury, is I was going to do the Camino de Santiago in Spain, which the particular route that we were going to take is a 475-mile route, and it took us 33 days. So that was coming up on October 1. My surgery was July 19th. So, like I say, the timeline was aggressive, but he was good, working with me on setting up a game plan. You have to have what I'm calling diligent execution of the game plan. It helps to have a great surgical team. It helps to have a great physical therapy team. But then the individual has to do what I call the homework, meaning the physical therapy doesn't stop when you leave the building here. And I would say to anybody that has injuries such as this, they really need to be disciplined enough to do this, basically 24/7 until they're healed. I think I calculated in the physical therapy that I did from post-surgery to the Camino, over 17,000 reps of physical therapy. So I guess you could say from a surgery to at least walking, that's 2.5 months, of which only 1.5 of that was weight bearing. So you will say there was a little bit of apprehension in actually being able to do this, but the whole team, Dr. Murken's team, as well as the physical therapy team, they did everything they could do, and then it was just left to me. After about 10, 12 days, I knew, okay, I can do this, but I just have to moderate my pace, and I did. I was the last one in every day, but hey, made it to the end. This is my souvenir from the Camino. This is the passport that you get, stamped every day you're on the trail, and this is what most people just covet and want to finish, and this is my souvenir. So the team was excellent, and I like to use the word team because you have Dr. Murken, but then you have his assistants that work with me a lot, as well as the people here at Panorama. Did lots of visits in here, so I would say it was an excellent experience. I think they've got a pretty good show here, and I would not hesitate to recommend people come here, as well as, which includes, as I say, the physical therapy group. I would basically say thanks for assisting me in getting back to doing what I like to do. Again, getting the most out of life, taking on more adventures, and they were an instrumental part in assisting me to get this done. So thanks, and keep up the good work.